Sounds good. All right. Well, thank you for the opportunity to be here today. My name is, I should begin. Thank you for the opportunity to be with you today across the other side of the world. But the nutrition family, as it's called in some places I've worked, is a small community of like-minded people with different talents and skills, but we all come together around a common concern for improving nutrition for those most vulnerable. My background is training in international and community nutrition from Cornell University. I've done field work in multiple countries, including Afghanistan, Bangladesh, Uganda, Kenya, Senegal, Bolivia, and Haiti. And I'm looking forward to sharing some of those experiences with you today, both at the community level, advocating for nutrition, but also at the national level, and even at the global level. There's some examples I didn't initially include here, but we could discuss that as well, if there's interest. COVID has hit us at a, yes?
Yeah, please go ahead.
COVID has hit us at an interesting time. Globally, there's been a lot of geopolitical
in 100 meters, turn left.
Tension, and both politically with the refugee and the migration crises, with the climate change situation causing difficulties for agriculture, and then climate migration. And I know Bangladesh is one of the countries affected by severe storms and climate migration issues. And we know that borders have been closing to migrants. And so there's a series of tensions going on in the world that are relevant to food security and health and nutrition, even preceding COVID. Now we throw in COVID as a health crisis. And while in nutrition, we're frequently discussing infectious disease, what's different about COVID is that it's not just, as we discussed in the previous policy dialogue, what's interesting about COVID is it's not just reproductive age women and preschool age children who are the most vulnerable to this. It's actually a different group. It's the caregivers of the vulnerable. It's the income earners, it's the elders, often people who mentor and teach and pass on how to be healthy and strong, lessons learned. Also people who help take care of children if adults are in the workplace. So we're losing the strength of our caregiving community with COVID. So that's a concern, and that's happening everywhere. And in this country where I am in the United States, I'm based outside of Washington, DC. What we find is parents more often than not are both working. Some of us, like me, are working part-time from home as a consultant, so we can be with our children while they're young and encouraging good nutrition habits and all. But in many cases, both parents are working outside the home, and older parents, relatives are helping watch children. And in the context of COVID, we are not utilizing those resources because they're over 75 or 80 years old in our case. So we, many people across the globe are finding either if they may have lost jobs, but they're also responsible for accomplishing their work requirements, but also needing to manage children. Schools have been closed, and so children are having to be schooled at home as well. So we have a very new domestic environment across the globe where children are at home, workers, if they had commuted to cities for work or day labor, they're now at home if there's not as much available work. But I know every few months the situation changes as people become tired of being stuck at home and are being more adventurous and going out with the different protective masks and social distancing, trying to find a way to make income and support their family. So it's an interesting time. And in the last policy dialogue, I said, you know, we're still capable of addressing malnutrition here because we've been given a framework through the UNICEF framework for the causes of malnutrition to how to problem solve. So it's just a shock to the health domain in our framework, and we need to work through the framework to solve problems.
So, what is your understanding? Like, as Bangladesh has already passed more than 3 years time after COVID, first case is identified, and we still find that the number of cases which are regularly we are getting, that is more or less the similar which we had 2 months ago. What is your understanding, like regarding this nutrition impact of the COVID? What will happen for Bangladesh and other developed countries?
I think initially the impact may be felt with the reduced income earning capacity as people have lost work. And if children received meals at school, if those programs are not continuing, children are not receiving the same nutritious meals that they may have been. I'm interested to know on the ground if you've observed those programs continuing in some capacity. So the food security component has received a shock in many households. Also, distribution of fruits and vegetables and foods, animal products from rural to urban areas has been disrupted. So the availability of foods in markets is likely affected by the COVID situation. People are not visiting health facilities as often to avoid exposure. So women who are pregnant may not be going for their checkups as regularly. They may not be on top of their iron folate supplementation to avoid anemia or neural tube defects with the folate prevention vitamin. So I think people are trying to prioritize health, and if something doesn't seem like an essential activity, we're also encouraged to stay home except for essential activities. So it'd be interesting to know if community health workers are continuing to do household visits in a safe way, perhaps from a distance, delivering supplements to pregnant lactating women. If vaccination campaigns are on hold, vitamin A supplementation campaigns, is all of that on hold in Bangladesh because of concern about contact and spread? Or is some of this continuing in a different fashion?
Okay, do you like to share the programs of your organization regarding the advocacy and planning for nutrition in COVID-19 situation? Sure. I also like to hear something. I know that you did work for the World Vision too. If you have also some knowledge about the World Vision's activities at this moment related to the advocacy, please add that point too.
Okay. I know that my organization that I am most closely affiliated with is the Agriculture Nutrition Community of Practice. That is a virtual community that has existed for 10 years now. And we are bringing people together approximately once a month or every few months to have something like what we're doing here, a dialogue where people are sharing knowledge and experiences. If they have results from a study or a new tool on the intersection of agriculture and nutrition. That's where my focus has been with an organization, apart from independent consulting work. The community of practice has been inviting people to share about measuring food insecurity in the context of COVID. So we've had some interesting webinars recently, and I can share some of those with you, some links to the recordings after this, and they could be provided in a comment box. Our organization it does pull together different professionals. So we haven't done studies ourselves, or we currently do not engage in independent advocacy work, but we bring together many people who do. So we have been trying to pull together from a recent webinar a list of lessons learned and recommendations for programs and advocacy in the context of COVID. So that is an ongoing work in progress as we think through next steps and problem solving. One thing that I do recall that came out of that, which I wanted to highlight on this call, is that COVID has made it more difficult for things to travel, whether it's people or resources, over a distance. But local health activities and local food security, food system activities are gaining attention globally, even whether it's in Europe, the US, or in developing countries. There's more focus on what do I have in my immediate community that can address my needs, so I don't have to travel far, use public transportation. I know people in this country aren't flying. Everybody's canceling any plans to fly anywhere except for a handful of people I've heard of. So apart from businesses transporting resources, over long distances, people are trying to minimize the travel required. So there's been an attention to strengthening local food systems, and we've tried to provide some advocacy support to our stakeholders related to that. And how do you identify the gaps in your local markets and the cost of resources for people, so that if people did need to shop only locally, could they acquire what they need?
Yeah, thank you. Can you also share some your stories about your experience you had while you advocating or planning for the nutrition? It would be great, as you know that recently in Bangladesh, Bangladesh National Nutrition Council, they did a projection that what will happen for nutrition due to the COVID-19. But my feelings is that if you share with us your stories regarding this advocacy and planning, then the projection we have done, we may make a plan for what should advocacy we need to do for implementing on the basis of our projection.
Sure. I'd like to share my screen. Is that working now? So the experiences that came to mind, I may start, I'll do an overview, then I may start with detail at the bottom of the screen. At the national level, I worked with the World Bank in the offices of Afghanistan and Kenya. We interviewed various stakeholders to try to understand what were the needs in nutrition and what did different sectors have available to contribute. What were their existing programs, policies, and how could we address nutrient needs through that? We generated reports with recommendations for each sector and learned that having a multi-stakeholder gathering works well when there's a champion to continue to call it together, similar to SUN, but not always mobilized by SUN. This pre-existed SUN in many contexts. And then the World Bank was able to channel their resources via these different recommendations to the different sectors. So I enjoyed meeting with officials in health and agriculture and social protection and education, and learning about what they thought they could do, and not having people stretch too far out of their comfort zone. And each country is different, but we were able to generate recommendations. For example, in Afghanistan, there were not adequate resources to run the administrative side of the nutrition office in the health sector. So resources to support the staff lines were increased. Things as simple as organizing a meeting and being able to contact stakeholders a photocopier with replacement ink cartridge funding, budget for refreshments. People were using their own resources because culturally you don't call a meeting without having some tea and refreshments. That's just not culturally appropriate. And outsiders wouldn't think of budgeting for that, but when you work together with the local stakeholders, you identify what do we need to run a successful office here to advocate and sustain attention to nutrition. So there were small logistical issues. There was the transportation, the communication with the officers in the different provinces. People didn't have adequate phone units. Computer internet access was poor. So sometimes people have a lot of training. We've, I think as a global community, tried hard to work with national level partners to have good training, but then putting that training into practice is often where things can fall apart if you don't have good communication, transportation, logistics for printing and putting on a meeting. So the World Bank helped address some of those gaps and helped fund conferences and meetings and that kind of activity in Afghanistan. And that led to a lot of good activity for a number of years. In Kenya, we had a lot of very active international organizations, World Food Program, UNICEF, and there was a lot, there hadn't been the history as there had been in Afghanistan of trying hard to work together multi-sectorally. The political situation there was much more difficult with a lot of concerns about corruption, which I know is also a concern in other countries, including Bangladesh. So we identified some advocacy priorities and champions within the different organizations who could champion them within their organization. And then the international partners working with their related sector, whether it was FAO with the Ministry of Agriculture, UNICEF, and WHO with the health sector, trying to make sure attention and resources were put into different programs. This is a bit of a broad and abstract overview. But I think in some countries, the national offices are stronger. I think in Bangladesh, I've been very impressed. And it always comes to mind when I think about international development that in Bangladesh, I think the national level people are so capable because your country has been emphasizing education of the general population to such a degree that you have a very talented population. And so people are confident compared to what I've observed in some other countries and not so eager for the international community to solve all the problems. What I've observed in Bangladesh is with some of these other activities that I did, like profiles. I've been to Bangladesh for various different activities, but the advocacy tool profiles, we identified some key messages, and I believe I worked with Eminence on this one. And in Bangladesh, you have a lot of very capable, talented, confident people who could work in partnership with international organizations to push an agenda forward. And with profiles, we would identify some key messages and then work through the media to try to disseminate those messages. Sometimes there would also be a meeting to share a presentation that we put together collaboratively that encapsulated these key messages. And it was a short video, but in the context of Bangladesh, what do people need to know about this, breaking the cycle of malnutrition for women and children? And what are some of the key interventions that need attention? And the short, 2 to 3 minute
150 meters, turn left.
Was something that could be quickly shared with other stakeholders and digestible long report that people may just put on a shelf or tuck in a pile of paper. So that was an exciting activity that I worked on both in Bangladesh and in Uganda. Other activities included community-based work. This is where my career began with NGOs in rural communities in Bolivia, Haiti, and Senegal. Senegal was actually with UNICEF, but the focus here was promoting nutrition at the community level. And to begin, we would spend time in communities, and depending on the scope of the program, we would visit representations of different localities, so that whatever we shared with people reflected their understanding of food or their understanding of what's appropriate to give to young children. For example, in Haiti, the international community really recommends that we feed eggs to children. You may have this belief in Bangladesh as well, but in Haiti, people said you cannot feed an egg to a child because cause the child to become a thief. And I was surprised because we don't have that belief here, but people said in Haiti, if a child learns to like eggs as they grow up and are crawling and walking and toddling, they'll start to steal eggs from their neighbors because the yards are adjoined. And as they get older and think there's nothing wrong with grabbing an egg here or there, they might start to steal larger things, you know. So they thought you can't teach children to eat eggs. So we thought about that. And I remembered in China, when you eat soup or you go to a Chinese restaurant, they will break an egg into the soup and it all becomes cooked and mixed in like a noodle, and you don't know it's an egg. And so I suggested, what if you mix an egg into things that you're already cooking so that kids don't realize it's an egg? And if they say, what is that? You can call it a misty noodle or something like that. Or you could do scrambled eggs and then mix that into rice or something like that, which is something also commonly done in China. So, so we would share ideas like that, and people thought, yeah, I can try that. I know in Afghanistan, when I did other community related work, similarly understanding local beliefs, they wouldn't feed beans to children because they said, you know, these legumes, children can choke on them, especially very small children. So I know that in Latin America, people mash beans and eat that in a tortilla, like a taco. And so I thought, well, perhaps they could mash the beans and the legumes, sort of like your dal. You've already solved the problem in Bangladesh with dal. So I proposed that in northern Afghanistan, and people said, yeah, we could try that. And they said, my children like it. You can mix water, boiled water in if it's too thick to make it thinner so that it's not, the children don't choke on it. So by understanding what people believe, you don't have to say, oh, can't feed eggs, can't feed beans. There is a way to overcome and work with local beliefs. So people will try something new for the nutrition of their children with local resources. If we hadn't done something like that, then and said, no, just feed them an egg, feed them a hard-boiled egg that looks like an egg, I was told, we won't listen to anything else you have to say because you don't understand our culture. So I think it's important as we work together with international partners. So from the Bangladesh perspective, as you work with outsiders, it's important to make sure that that these ideas for advocacy or community-based nutrition promotion are tested out with people in the target communities. So the messages, you can make sure and do damage control that the messages are actually going to lead to the desired results. In Senegal, we promoted vitamin A, and I noted that the international community was excited about the supplements, but I noticed that they had red palm oil, they had a lot of leaves that they would cook and put on the side of the rice, and there was one other very vitamin A, mangoes, tons of mangoes. And so I made sure that we included an emphasis on the local foods that would produce a lot of vitamin A in the diet, because you never know if the supplementation delivery channels will be disrupted. Perhaps in COVID, we're not getting the same international donations of these sorts of things. So it's important to strengthen understanding of what's available locally in your environment to address your nutrition problems.
Yeah, thank you, Emily. It's a very interesting stories, and the last stories, as you mentioned, about using the local resources for making the nutrition food for the children, as you used mango in Uganda. I think that there is a lots of local, available food as well as fruits and other, ingredients which can be used, and advocacy can also be focused on these issues. However, can you share that what should be the role of government in advocating and multi-sectoral planning for nutrition during COVID-19? Because this is a special time. Still, our government in Bangladesh, they're still struggling to understand the multi-sectoral role for nutrition. I think that your suggestion and your experience will help us to emphasize and engage multi-sector for nutrition-related activities due to the COVID-19. Please.
Thank you. Well, ultimately, it's the responsibility of the government to assess the needs of the population and to mobilize its various sectors to work to address them or to build capacity in the population to address them. I know different countries are more or less socialist in terms of the government doing all of the work, or the government having a stepping back a bit and letting the private sector or religious institutions or others addressing the needs of the poor and vulnerable. At least in the United States, that's sort of the division of thinking. That is it the government's job to take care of the people, or is it not the government's job, but the role of the private sector and civil society? So, Bangladesh is where it is on that spectrum. I think what first occurred to me in the context of COVID is that saving lives and understanding how the disease is passed around and how trying to block the transmission is going to be what the focus is of government officials right now. So the health sector is the predominant area of attention. Nutrition generally falls through the cracks when there's a big health, whether it's HIV/AIDS or whether it's malaria or it's Ebola, in parts of Africa. If there's a huge epidemic, now a pandemic, that's what's going to be most of the focus, and the advocacy for resources from the government are going to be to address this immediate brush fire. It's a long brush fire we're dealing with, but so I thought about, if I was working in government, what would my responsibility be? And I also then took a step back and thought, well, people working in government are dealing with perhaps death in their own families, social isolation, which isn't good for any human being. Also, the places for physical fitness are generally closed. And so people may just be not as well because being out in public or going to exercise, all of these things are affected. And so our civil servants as individuals need some compassion, because they're also, like all of us, dealing with their own personal situations and crises. And even perhaps restrictions on going to places of worship, mosques. I don't know how that's affected, but I'm assuming there's restrictions of some sort. So that was, I thought, the first step, is understanding the situation of our civil servants. The health sector and then the economy are going to be the primary areas of attention. And as we look at our framework here, socio-political environment is at the bottom right. We know that between the physical environment and the resources in our natural environment that we have to contribute to nutrition, whether it's the food, the water, the opportunities for income generation from the environment, whether it's agriculture or mining. The physical environment does contribute a lot. In Bangladesh, there's a lot of fishery work. So the government is working at sustaining the economy so that it doesn't collapse in every country right now. And so presumably the attention is going to be on safeguarding the sectors of the economy that generate the most for the nation's GDP, if there's any debt servicing, safeguarding those portions of the economy so that they don't default, worse on debt. That may or may not help the most vulnerable nutritionally, because it may not be the smallholder farms or those working in fishing or fisheries that are assisted. So that may be where the NGOs and other civil society organizations can step up their work. But my sense is that the government is also working on health services, trying to make sure that the doctors and health workers have the protective equipment and then the medical resources to address the disease. So to improve nutrition, as I've reflected on COVID and nutrition, a lot of attention in recent years has been on thinking through nutrition specific, which would be at the top of the framework, improving diets, and childcare, especially. How are we feeding children? But then there's also been discussion in recent years on nutrition sensitive interventions, which is more at the bottom of the framework. The underlying causes related to education, income generation, agriculture and food security, access to clean water, hygiene, support for women and women's health, and all of those things which underlie what you're able to eat and have access to eat and how healthy you are. So I think COVID is providing an opportunity, some silver linings, on hopefully strengthening health sector and community-based health activities, I hope. Because we don't want people traveling in groups or crowds to an urban area so much. So it may be that activities are happening, and I know there had been community-based health promotion and that sort of thing, but perhaps we can be strengthening the health sector with all the attention on it in a way that allows for long-term strength where there may have been gaps in the past. One of the things that occurred to me was, can we equip households to do some of their own nutrition monitoring, nutrition status monitoring? I know households here mark the doorways as your children grow, and my children are very excited about being measured every month or more often than that. Have I grown an inch in the last month? And I said, well, have you been eating well? Have you been sleeping well? Have you been exercising enough? So I think we could try to equip parents or caregivers to be mindful of and parents know, are your kids getting a little taller? Are your kids getting, and you can measure that. Are your kids getting heavier? You could measure with a stick. If you can find a straight stick, you could keep that in the house. It wouldn't have to be shared. And just measure change. Growth monitoring, we're trying to measure linear growth and weight. And is that changing a little bit, gradually over time? Parents generally know when their kids are heavier or more skinny. And even if you can't be going regularly for growth monitoring because of trying to avoid exposure to COVID, parents can be given, the general recommendations. If your child is not growing well because they have an infectious disease, perhaps, you need to address the diarrhea, or perhaps need to get treatment for the respiratory infection, or try feeding a different blend of foods. Diet diversity promotion is something that could happen at the local level. I may be jumping ahead, but I think the government is focusing on the underlying causes right now. But I had some thoughts about what could be done if, as I heard, resources for nutrition have been low in the context of COVID, at least direct resources have been low. But that's okay, because we have nutrition sensitive interventions, and that may be where the attention is right now. I know food security is getting some attention, which is great. So there could be social media and media promotion of diet diversification, making sure people are eating a diverse diet and not just selling anything that might be of high value that they're receiving, especially the women and children, preschool age children, women of reproductive age, getting that diverse diet. And you can measure 3 to 5 food groups a day. And breastfeeding is free. It's not easy, but with more family members perhaps being at home, women might have more support, especially if they've been working outside the home. Now they're at home. It may be that they're able to do that 6 months of exclusive breastfeeding on demand, which is a tall order for women. Part of why I'm at home is I wanted to try that. If we're recommending it globally, how hard is it? I found it really hard to do anything outside of the home and exclusively breastfeed on demand, which we're telling women to do. So I now have 2 children and they're 5 and 7 years old. And I did try to follow the recommendations up to age 2 and beyond of offering my milk plus additional foods after 6 months. And it's hard for women everywhere. And irrespective of socioeconomic status, we find malnutrition in that vulnerable age group between 6 months and 3 years. So the role of government is likely going to be restricted to fighting the pandemic and securing the economy, but civil society perhaps can step in and reassure people that with the available food they have and the knowledge they may have about proper infant feeding from previous interventions, it would be a good time, I think, for reminding people about diet diversity, the importance of breastfeeding, and just using the social media and the media to get out these key messages. Because hand washing for COVID is going to help with reducing infectious disease, which improves health status. So that's great. If we have a lot more hand washing going on, we may have the reduced diarrhea, God willing, that has been a plague on young children, contributing to malnutrition in countries like Bangladesh. So those are some thoughts I've had about, how COVID is sort of a double-edged sword. There's benefits to the long-term sustainability of local food systems, I hope, and maybe strengthening community health work. And yet, at the same time, we might not have as much funding for supplementation activities or direct nutrition promotion at the community level in an organized sense. Those interventions aren't receiving funds, but so many people are connected digitally through cell phones and Facebook that I think there's still an opportunity to get messages out.
Yeah. So Emily, as you mentioned about this, all the intervention you talk about, that is, I understand that this is more or less direct nutrition intervention. But do you have anything to add related to the, nutrition sensitive activities?
I do. I wanted to pull up another document that I came across. I haven't been in Dhaka for some years, but there is an activity that was completed and written up last year called Fill the Nutrient Gap in Bangladesh. WFP has produced this report, and it came out, so the General Economics Division of the Bangladesh Planning Commission was involved. As I said, WFP, the level of the cabinet, they had some contributions. But as I went to the executive summary, they did a multi-stakeholder analysis in Bangladesh for nutrition to fill, what do we need to do to fill the nutrient gap in nutrition? They talked about the progress that's been made so far, the policy frameworks in place, the engagement of different government and agencies and nonprofits. There was a World Bank study to look at the changing drivers of malnutrition in Bangladesh. with the triple burden, the overnutrition, undernutrition, and micronutrient deficiencies. And there were 5 major conclusions. And so these relate to nutrition sensitive. The food environment, at least 1 in 8 or 13% of households cannot afford to meet their nutrient needs. So we have a financial economic access constraint, which is either income or the cost of foods or both. Food safety concerns might jeopardize the availability and affordability of nutritious foods. So if we have problems with food safety, that would affect the food supply. Demand is increasing with the growing population. So they recommend strengthening the safety of the food supply. So that's maybe not a direct nutrition intervention. It's not a nutrition specific intervention, but it's a nutrition sensitive intervention. So I thought that was useful. And that's hopefully getting attention in the context of COVID, as we learned in 2008, when there is an economic crisis and a food price crisis, people become restless when there's food insecurity, and that can lead to a national security situation that countries don't wish to have. So the Feed the Future initiative from the United States Agency for International Development and the US government was partly funded through the Department of Defense as a whole of government contribution, because they know when there's food insecurity, you can have unrest. And nobody wants that. So I believe that there is now an awareness of this, and that resources, perhaps even from defense budgets, could be put into food security and the safety of the food supply and the cost accessibility of diverse diets. So that was a key component. And then consumer choice. Are people making healthy choices? We know with climate change that encouraging people to eat less meat will be helpful to make sure that the arable land is not predominantly used for grain for animals, but for plants for humans to consume. And so I know in our own family, we're trying to have meat at celebrations, or once a week when we get together with my in-laws and sister-in-law, we try. Maybe when we go out to eat, we eat the meat at that time. But when I go to the grocery store, I try to minimize the amount of meat that I'm purchasing, which requires a change in our lifestyle and how we think about a healthy meal. Eating vegetarian is not the norm for most people, but it is a healthy way to eat. And if you can have meat once or twice a week instead of every day or multiple times a day, you can keep up your iron levels adequately if your portion size is about 6 ounces or so. So that's something to think about. So they discussed food choices, dairy, and fruits and vegetables. One of the concerns with fruits and vegetables that my colleague Anna Herforth has worked on, she's a colleague through the Agriculture Nutrition Community of Practice, is that most countries do not have adequate fruits and vegetables available in the markets for, or even available locally if people produce them themselves, for people to have the 3 to 5 servings per day that are recommended. So apart from some countries in Southeast Asia, no one globally is meeting the recommended intake of fruits and vegetables. So that's a concern. And there are people working on that, trying to help advocate that ministries of agriculture and of ministries of economy and planning think about addressing the food needs with more of a plant-based diet, which we know is also healthier for people. And healthier for reducing the impacts of climate change. So that's an important area as well. 3 was supply chains. For healthier diets, investment is needed to simultaneously increase demand and supply of nutrient-dense foods with a focus on food safety, environmental sustainability, and nutritional value. We know that the Green Revolution helped achieve self-sufficiency in the rice supply in Bangladesh and elsewhere, although attention was much less to the legumes, the dal, that which could be used to complement the rice for a good nutritionally balanced diet. So there's been a discussion to bring back the attention to the legumes for the protein, the plant-based proteins, to help have a complete protein diet. Fish and fishery work is important. I know World Fish has been active in Bangladesh. And some access to dairy is also useful. Calcium can be obtained from dark green leafy vegetables. And so incorporating some of that in with rice or in legume dal preparations is another good way to get calcium into the diet. Dairy is not a good source of iron, so we don't need to think about dairy for that. But I know my son does not like milk, so we try to encourage him to eat greens, and he loves greens. And so my daughter drinks 2 glasses of milk at a meal, and my son eats a pile of greens. So there's multiple ways to get to the same end, and greens are more sustainable. And we have to be careful of all the hormones in this country given to cows to produce milk. You don't want those hormones in your child. So, you know, it's more expensive to buy the healthy milk. So I'd love it if she would eat the greens, but she currently doesn't. They talked about disasters and weather shocks and how we have disaster preparedness when we know that we're in hurricane or typhoon season, pre-positioning supplies and resources so that food security can be safeguarded. That is an important role of government and together with partners. And I know Bangladesh is very experienced in this sector, but that is where government is focusing. That is a nutrition sensitive intervention, making sure that you're prepared for the annual disasters that happen with storms and such. Social protection programs are a part of that. Sometimes social protection programs are will exist also throughout the year and assist with access to food and education and health resources. So number 5, did we skip over number 4 here? Social protection was number 4. Number 5 is underserved groups. For those just joining, we're looking at the Filling the Nutrient Gap summary report for Bangladesh that was put together by WFP and government partners and other partners. Underserved groups, this is the 5th of the top 5 summary points from this report. Adolescents are the most nutritionally vulnerable individuals due to their high nutrient requirements. They're actively growing and also maybe having children, so women may be getting pregnant, you know, in their teens. And so it's critical to make sure we have healthy adolescent girls. This is particularly true for girls, given unfavorable gender norms and practices. The nutrition needs of adolescents and the elderly are currently largely unaddressed. In the context of COVID, we know that the elderly are the most vulnerable to the infection, to the virus. So that may be a new area. I'd be interested to hear if there are interventions for the elderly that have sprung up, whether it's food security or supplementation activities to help the elderly. I know that HKI and Save the Children had been doing some work on anemia in girls when I was there a decade ago. So I know that there has been attention in Bangladesh to making sure young girls are getting all of the nutrients they need. And hopefully some interventions have arisen from that. But it's helpful to have understood and identified the priority groups and that we do have interventions available. I love working in nutrition because we're not trying to find a cure for COVID or a cure for HIV. We have the solutions. We just need to understand, as we look at our conceptual framework, we we need to look back here and say, okay, which solutions domain do we need to draw from to solve a problem? Because we've solved all these different problems before. Which ones do we need to focus on and put resources into now?
Yep. Emily, you discussed lots of issues, right? You know, what you need to do, what should be the government's roles. Can I request you to share your opinion that, you know, regarding what should be the role of donors organization and intervention agencies in terms of advocating and multi-sectoral planning during this COVID-19 situation regarding the nutrition?
I think donor organizations work best when they work collaboratively with the local government and its partners. People from the country and based in the country will know the situation best. And the outside organizations are always operating in a best practice when they look at the policies established by the local government, the nutrition policies and priorities, for example, set out in this filling the gap document. And if I was a representative of a donor foundation or bilateral agency, I would be interested in pulling together the stakeholders that worked on the filling the nutrient gap report, for example, and doing the assessment of what resources already exist to address these 5 priority areas. Where are the gaps? And where would resources be needed? We know that some countries are more interested in certain sectors. I've worked for the German International Development Agency, GTZ, and they really love food and agriculture. They do like public-private partnerships, but they've also definitely impact in the agriculture food security sector. They do like public-private partnerships, but they've also There's an echo.
Yeah, that is you. No problem. Carry on.
So I know the Scandinavian countries are also very interested in this sustainable food system holistic approach, and are involved in South Asia. There are other countries, whether it's USAID or the UK or other European donors or the Japanese agency for cooperative assistance, that they will have their priority areas that they will come into Bangladesh with, and they'll say, we have funding for hygiene and sanitation. How can we help? And I didn't see that listed in the top 5 here when we looked at that list. But one could, if that's the restriction on their funding, for example, one could look at the health sector in Bangladesh and identify, are there still provinces in the country where we don't have adequate access to clean water, or we don't have good hand washing practices ongoing, or perhaps in the slums, are we still not seeing the hygiene practices we want? So perhaps their contribution could strengthen work there. So I think it's using the national policy priority documents in collaboration with outside donors and intervention agencies is the first step. And then finding areas of mutual interest, and then identifying where there are gaps and coordinating the development donation response, so we don't have 3 donors contributing protective equipment and nobody contributing to food security.
So in that perspective, at the situation in Bangladesh and other developing countries, what is your understanding that what is wait for our future for the mankind if this type of COVID-19 situation remains in the long-term perspective? What you're thinking about? What is going to happen?
So I think it's a bit bleak, to be quite frank. I didn't have a whole lot of optimistic thoughts here. I think that Bangladesh is blessed at being a religious country. I think that the West has become so secular that when there are crises that affect your mortality, it becomes an existential crisis. I think in Bangladesh, as in Afghanistan, I worked there for some years, in the Muslim context, people recognize that death is not something that we always have to fear. It is not the end of the world. And it may be, if this continues for a long time, that we have to make our peace with maybe dying young, with relatives dying, if we have to go on living our lives. I think that there will be impacts on education, depending on how governments open schools or don't. I know in this country, we've been homeschooling for a while because I've been very picky about what I want my children to learn and the rigor I want them to have. Unexpectedly homeschooling, but now that everybody is being encouraged to homeschool, sometimes I feel a little ahead of the game. But we may need to be equipping parents with the resources to educate their children. I don't know how reasonable that is in the context of Bangladesh, but there may need to be ways of supporting education, home-based education, in ways that we haven't ever had to think of before. Basic literacy goes a long way, and basic arithmetic can go a long way. The curriculum I happen to be using for my children is what the US and England largely used in the 1800s and generated brilliant, articulate people who could write well and speak well. The educational system in the US after 1950 has produced very poor students in general. And so we're in a crisis of education in this country. So there's been a huge burst of focus on homeschooling and home education and places where our educational systems have collapsed. In terms of health, like I mentioned, we may be facing a lot more death. I think people are going to hit their limit of being stuck in their homes and taking the risks of going out and working. And fortunately, in many developing countries, the population is younger. We know in Africa that many people are not succumbing to COVID because they're just younger. The population is on average, 15 or so years old. And so children and young people are not as vulnerable. So we may find a change in the population distribution as we lose some of our older, wiser, mentor-aged people. So an activity that would be a beautiful thing now that families could do is gleaning all the wisdom they can from their elders and writing it down, lessons learned about life and all of that, because we may be, if this goes on for a while, we may be losing a lot of our elders. If this is like the worst case scenario situation. I think the biggest area I think for innovation is going to be economics. How are we going to sustain our economies when people are trying to avoid interaction? And it's the middle and lower level skills in the economy. Factories are going to be at lower output, or redesigning how they produce because they don't want to have people so close. Costs may go up for certain things. We may be living in a less materialistic culture because we won't have as much. We'll be more content to do things ourselves. Suddenly I'm cutting everyone in my family's hair. I never did that before. So everyone I know is starting to cut their husband's hair and their children's hair and all of that. So there's just strange things happening because we're avoiding using other services to avoid contact. But I think innovating to help people who might have been involved in the informal economy to maintain income is going to be critical, because the most nutritionally vulnerable households are also the most economically vulnerable in all of this. And long-term cash handouts from government are going to hit their limit. My government is sending us stimulus checks every once in a while, trying to help us out. But after a while, they can't keep doing that. So, lots of businesses, restaurants, even schools, private schools are closing as people are keeping their children home. I think we're going to face that kind of thing. But as I said at the outset of this question, I think we need to dig deeper spiritually and know that what the enemy of our souls has meant for evil, God, Allah, can use for good. And that's in the holy books. So I hold on to that.
Yeah. Emily, just when you were talking that time, there was a lot of viewers of our today's webinar. One colleague from CARE, he just mentioned that CARE also has a community-based, multi-sectoral advocacy program. So he mentioned that their program also very effective at the community level. So I thought that I should share with you regarding this CARE intervention for advocacy related to the multi-sectoral engagement. However, finally, can I request you, what is your recommendation for Bangladesh and other developing countries in terms of do the advocacy to ensure the nutrition status and resource mobilization, as well as government should prioritize the nutrition for their country, or maybe maybe government can think about regional partnership as well as maybe local level intervention. What is your recommendation? This is our final question to you.
It's okay. I think that a lot of work has been done in nutrition in recent years, identifying measurement tools for dietary diversity. And I think this is a good opportunity for sharing simple messages about that to the general public. Right now, I wouldn't say that I plan my meals every day thinking about a particular like a nutrition message, but as a trained nutritionist, I do try to make sure there is a diversity of foods on my children's plate and my husband and myself. But I think we want every person who's eating and preparing meals to have in their mind, what is the key message about diet diversity during this time? And if they have restricted food supply and food access, what can they use to meet those different food categories? With climate change, we do need to be advocating for a more plant-based diet, which is new and different for some people. The wealthy here are getting on board slowly, but there are wonderful things to eat, like hummus, which comes from the Middle East, which is chickpea based, with a little lemon. There are ways to eat a healthy plant-based diet that feel lovely, so that don't feel like you're not eating meat, so therefore you're deprived. I think that advocating for breastfeeding, we may have an opportunity to increase our numbers on that, because people are required to be at home. Women are required to be at home, perhaps with their children, in a way that they haven't been in more than a decade, with women getting more professional opportunities and having their children in childcare. they may not be choosing that in the context of COVID. So we could remind women that the best practice for the safety and health of your child to avoid allergies and future health problems is to give them your milk, ideally for the first 6 months exclusively, and then ongoing until they're 2 years and beyond, if you can do that. And let's help them to do that. I think that it's important. We haven't talked about family planning. I know it's a big deal in your country, and as Muslims, and I'm a Catholic, it's a tricky subject, but birth spacing is something we can talk about with everybody close together. I know in our country, they've talked about the increasing rates of teen pregnancy. So I think it is important to have some attention to birth spacing. I'm not an advocate of contraception myself, but we do use natural family planning in the Catholic community, and there are ways to make sure women are not getting pregnant year after year after year and depleting their own bodies of their nutrients and becoming weak and having broken hips at too young an age and losing their teeth and all of these, a lot of anemia and dying in childbirth because they've never replenished their iron supply and all of that. So I think that there's a need for that. Exploring the local food systems and engaging children to think about making a map of their community, perhaps, and involving them in identifying what foods are available to fill those different diet diversity categories. Because we know that if we can try to get that diet diversity message out and then equip children and families to own that message and own that, then I think we'll be far ahead of where we've been at promoting nutrition, which nutrition messages change all the time with changing science. But I think diet diversity will never change. Breastfeeding promotion will never change. I think some of the universal messages and using as many local resources that are affordable as possible, that hopefully will never change. And where you have communities in your country that have very restricted market access, that's an important area to focus on. Or if people aren't sustainably growing their own, food supply, which most people who grow their own food still use markets. So.
Yeah, Emily, thank you so much. I think today's discussion will help Bangladesh as well as eminence and nutrition community to take forward the this agenda in terms of our upcoming development activities, as well as overcome this COVID-related problem. I think that still Bangladesh is trying to manage the nutrition COVID-related cases to provide the health services, to provide their clinical services. But it is important to consider these nutrition issues that is upcoming problem. Maybe this is still problem, but it is not recognized as it need. So I think that today's discussion will help government as well as nutrition community to take some advocacy activities related to the nutrition, which is really, really important for our country. As you know, that Bangladesh has a malnutrition problem. It's a big problem. Though we have done, some sort of successful intervention in the last 1 decade, but there's still long way to go related to the nutrition. That Bangladesh did a very tremendous job in terms of agriculture and food production, but in terms of nutrition, we have a big gap. We hope that your recommendation will help us to take forward this agenda. Emily, thank you so much from my personal side, from eminence. You are always generous and grateful and kind to eminence, as well as for Bangladesh to give your time and always try to support us. I should say that you did a lot. You always do. So thank you so much. We are going to finish today's program, and thanks again from Bangladesh.
You're very welcome. It's been a pleasure and honor to work with you.
Thank you, Emily.